in our audience interaction segment later on, so do keep it locked on to Newsbreak on Lotus FM. Let's head now to our first story, and it has to do with Allergy Week. It is World Allergy Week, and South African medical experts are actually classifying allergic diseases as a chronic health crisis rather than just the minor seasonal inconveniences. Now, the Allergy Foundation of South Africa, also known as AFSA, have highlighted that everyday foods are posing severe unpredictable risks, pointing to a recent incident where a consumer suffered a life-threatening anaphylactic reaction from a retail sandwich. Now, the organization has launched a new consumer reporting tool while urging the public to prioritize professional medical diagnosis. Here's the director of AFSA, Dr Thulja Trikamjee, who elaborates further.
Essentially, the reason World Allergy Week has come about, it's been decided upon by the World Allergy Organization, and in South Africa, the Allergy Foundation as well as the Allergy Society has decided to partner with them to really highlight allergies as a significant issue, because we find that allergies are often trivialized. I'm sure listeners know, and you know yourself, that sometimes if you sneeze or you sniffle or you rub your eyes or you rub your nose, people just kind of like trivialize it and say, oh, it might be some sinus, it might be change of season, it might be a little bit of hay fever. But this here is one of the symptoms of a myriad of conditions that can actually lead to significant impact in patients' quality of life. So essentially the theme of this year is allergy care is essential care. And what we're trying to do globally is we just want patients, families, caregivers, as well as healthcare professionals to know that allergies are not just minor inconveniences.
In my introduction, I made mention of an alarming incident where a consumer had a severe reaction to a basic supermarket sandwich. Now, while this could be an isolated incident, tell us more about some of the gaps then in food labeling currently. How does AFSA's new product reporting tool help in this matter?
In South Africa, prior to this, we didn't have anybody or any organization that was really embarking on a project or really embarking on a campaign to get our food labeling properly done. And I think for the patient to understand this, a nice example I like to use is if someone says to a patient that you have a nut allergy, what does that really mean for a mother who has a child with a nut allergy? Does it mean that when you read labels, you must avoid things with all nuts? Does it mean you only avoid things with a specific nut? So those are things, A, that we need to try to be more stringent about, so that patients who have allergies, A, are protected, but also that you know what you categorically can and can't avoid. The second thing about that is often labels are hidden. So, a person who has, for example, a milk allergy wouldn't necessarily know all the hidden ways in which milk solids might be labeled in a particular food item.
Many people tend to downplay early warning signs and try to self-manage their symptoms. So tell us a bit more. Are there any specific red flags that mean it's now time to stop ignoring the issue and seek professional medical help?
So, Matthew, essentially, a lot of people just think that allergies are when you sneeze or you itch. Allergies encompass, yes, the hay fever or the sinus, which most people colloquially refer to, which we call allergic rhinitis. Those symptoms in your nose are called allergic rhinitis. Most people don't realize this, but asthma is most likely in most patients an allergic condition. So allergic rhinitis, which starts in your nose. Then, a lot of patients, especially now in winter time in South Africa, would say, I just get that dry, nagging cough at night. Every night I wake up and this cough is interrupting me. It happens worse in winter. Those things are early warning signs that your upper airway was affected, your lower airway or your chest is now starting to be affected as well. And if we don't manage this, it can get worse. As we know, asthma is a killer. Asthma is one of the biggest causes of mortality globally. So this is something that we must take very seriously.
And that was Dr Thulja Trikamjee, the Executive Board Member and Director of AFSA, which is the Allergy Foundation of South Africa. And just a fun fact, Thulja Trikamjee is actually the daughter of the late Ashwin Trikamjee. World Allergy Week, meanwhile, runs until the 27th. It's Newsbreak on Lotus FM. Let's head now to a first traffic update. Here's Rob Byrne.